Today, we're diving into how physician leaders can start thinking like CEOs, adopting business strategy, delegating skills, and long-term vision that ensure that the practice thrives decades from now. We're facing industry consolidation, margin pressure, burnout, and evolving reimbursement models. That's why leadership born of strategic clarity matters now more than ever. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 140, Thinking Like a CEO, Business Strategy for Medical Practice Leaders. Welcome to Medical Money Matters. Today, we're diving into how physician leaders can start thinking like CEOs, adopting business strategy, delegating skills, and long-term vision that ensure that the practice thrives decades from now. We're facing industry consolidation, margin pressure, burnout, and evolving reimbursement models. That's why leadership born of strategic clarity matters now more than ever. When doctors enter leadership roles, they often default to clinical thinking. Fix the immediate problem, order the necessary test, treat the individual patient in front of them. That approach works in the clinic, but as the leader of a practice, you're not just treating the next patient, you're steering the health of the entire organization over the course of many years. You're making choices that won't show results today, but 3 to 5 years down the line. Physicians bring incredible strengths to the CEO mindset: clinical credibility, pattern recognition, commitment to quality. But translating those qualities into strategic leadership often means stretching into new territory: long-term planning, financial fluency, delegation, culture building, and keeping your eye on strategy while the day-to-day hums underneath. First, developing vision clarity is essential. What will this practice look like 2 or 3 years from now? Are you known for a specialty offering that sets you apart, or service lines optimized to grow revenue and referral patterns sustainably? You need a narrative, a story of what you're building that resonates with your clinicians, staff, and even your patients. That narrative guides priorities and decisions, supporting marketing, hiring, and operations. Without it, changes happen in reaction rather than by design. That ties into financial fluency. You don't need to memorize every line of your profit and loss, but you must understand revenue drivers, payer mix, reimbursements, procedure contributions, accounts receivable management, and the levers that move your margins. Know how your labor costs compare to benchmarks. Understand how growing a service line changes fixed cost absorption. When you're deciding whether to add another provider, expand imaging services, or drop a payer contract, your decisions should reflect return on capital and long-term margin, not just headcount. Operational oversight is next. A CEO isn't in the weeds of scheduling or data entry, but they must ensure that systems are efficient, workflows that deliver care consistently, KPIs that are tracked, and accountability structures that signal when processes break down. The goal is not micromanagement, but designing workflows where the team knows their priorities and can own the improvements that need to be made. Talent development is often overlooked. Who are you hiring as your practice grows? Are they aligned with your culture and long-term goals? As CEO, you're building a leadership layer: clinical leads, operations managers, billing directors, people who internalize your mission and can drive parts of the business. Investing time in mentoring these leaders lifts your capacity and builds bench strength. It also ties into succession planning, preparing those future physician and administrative leaders who can take the reins one day. Change management is inevitable. EMR migrations, payer recontracting, new value-based initiatives, expansions, or mergers. These can trigger resistance if communicated poorly. As CEO, your role includes shaping the vision behind the change, explaining why it matters, and listening to concerns along the way. Communicating clearly, often, and authentically is how you bring people with you rather than pushing them along. Now, let's talk delegation. In a clinical setting, delegation often runs on hierarchy and licensure. Physician delegates tasks to nurse or medical assistant. That model doesn't translate straight to business operations. Business delegation is horizontal and task-based, assigning responsibilities to a team member who has the right skill set and authority. This requires trust structures such as clear scorecards, defined responsibilities, timelines, and regular check-ins. Physicians struggle because delegating feels like giving up control, but done well, delegation is a leadership multiplier. It frees you to focus on strategy while ensuring execution through others. At this level, it's vital to distinguish between urgent and important work as we've defined on the Eisenhower matrix. Running a practice demands time in quadrant 2, tasks that are important but not urgent, like planning, system design, culture, and growth strategy. Spend less time in firefighting, more time shaping where the organization is heading. So what should a CEO in a medical practice focus on? You're listening to Medical Money Matters, a weekly podcast brought to you by Healthy Practices, a healthcare consulting and revenue cycle company dedicated to keeping our clients independent. Please reach out if we can do anything at all to support your practice. You can find more information online at healtheps.com. That's www.healtheps.com. Please follow or subscribe to get all future episodes downloaded as soon as they're released. Strategy is number 1. Understanding your market position, reading referral and payer dynamics, deciding where service lines should grow or contract. You're not just the doctor in the room anymore, you're also an architect. Culture comes next. Burnout is a real threat, and culture, how people communicate, feel valued, and align with mission, affects retention, performance, and quality. This means you invest in staff well-being, recognition, and developing a values-driven workplace that aligns everyone around purpose. Then comes growth. Whether expanding locations, service offerings, adding ancillary services, or connecting with new payers, growth should follow strategy and reinforce your mission. It should be thoughtful, not just volume-driven, but aligned with what you can execute well. Risk management cannot be ignored. From compliance and credentialing to malpractice exposure and financial variability, a CEO has to balance innovation with prudence. You establish guardrails, ensure that proper insurance and oversight are in place, and forecast adverse scenarios rather than waiting for them. Succession planning might feel far off, but it is critical. You need to develop future physician and administrative leaders. That might look like mentoring senior clinicians to take leadership roles or preparing a COO or operations lead who can step up. Without it, you're building a house with no exits. Medicine and business aren't worlds apart. Both require pattern recognition and decision-making under pressure. In the clinical world, your decisions often rely on evidence-based medicine. In business, you use data, projections, and scenario planning, but sometimes decisions happen with ambiguity. Both demand clear thinking and trust in your team. In both, communication is foundational. Whether explaining a diagnosis or selling a strategic vision, delivery and clarity shape outcomes. Culture and trust matter equally when you're coordinating care or running an organization. But there are differences. Medicine is regulated, evidence-based, and patient-focused. Outcomes must be predictable and compliant. Business accepts ambiguity, risk, and trade-offs. Business demands return on investment thinking, trade-offs, and decisions that might not show up in a patient chart, but they do show up on the balance sheet. That's why physician leaders must learn both worlds, embrace the rigor of medicine and the discipline of business. Thinking like a CEO is not about abandoning your clinical training, it's about applying leadership, strategy, and operational thinking to the same commitment to quality and mission that motivated you to get into medicine. As we wrap up, remember, thinking like a CEO means working on the practice, not just in it. It means setting vision, tracking finances and operations, building systems, developing talent, delegating wisely, and leading change with clarity and purpose. You don't need an MBA to lead strategically. You do need clarity about where you're going, consistency in how you operate, and the right support structure in your finance, operations, and leadership team. Healthy Practices centers on helping physician-led practices grow sustainably, not just to survive, but to thrive. If you found this episode useful, hit subscribe, share this episode, and let us know what challenges you face in thinking like a CEO. We'd love to help. And remember, the difference between today and your best practice in 3 years isn't just luck. It's intention, strategy, and disciplined execution. Thanks for joining us on Medical Money Matters. Catch you next time. You can find more information online at medicalmoneymatterspodcast.com, and you can sign up to be notified when enrollment opens for the Medical Money Matters e-learning program for a mini MBA physician style, which will carry CME credits and will be released in upcoming months. In that, we'll do an even deeper dive so you can understand dynamic budgeting strategies, cash flow forecasting, and other more esoteric financial concepts. We've included those links in the show notes. As I like to close out these podcasts, congratulations on taking the next step in your professional development and for making the commitment to learn about the financial and business aspects of your practice. I look forward to being on this journey with you and send you my heartfelt gratitude for all that you do for your patients all day, every day.